Start ಮಾಡೋಣ. Okay. So last class we spoke of Causticum. I just gave you the introduction to Causticum. Okay. So have you gone through, if you have any questions to ask, quick questions. We mainly focused on the causative factors, ailments from. And from ailments we try to understand what could be the probable mentals. Okay. Should we revise or is it clear? Okay. So if it is clear, we also try to compare few remedies related to grief. Okay, ailments from grief. What are all the probable and most commonly indicated remedies for grief? We try to discuss. Okay. So if this is clear, we'll look at. I also told you that they're very affectionate. They care. They're very anxious for others. Okay. Now, what will happen when the skin is suppressed? In Causticum, you see few things happening here. Fine. I was talking to you about mania, impaired hearing, paralysis, hemiplegia, and convulsions. Okay. And we are also looking at the physical ailments. Two very important things I was trying to focus. One was exposure to dry, cold air and bad effects of burns. Never well since burns. The other remedy? Carbolic acid. Very good. Carbolic acid. Okay. See, today, as I was trying to tell you, PG learning is all about exploring new methodology. Okay. How depth we can go, how well we can understand a concept is all about PG learning. So keeping up with the tradition of PG learning, hopefully next 30-40 minutes I'll be focusing on one small area. But this small area, how it can be understood differently is what I am trying to explore in today's class. Okay. Now any wild guess what is that I am going to share or explore? We are looking at the action of Causticum on nervous system. Okay. Again, from your UG knowledge, you know that Causticum acting on the nervous system, it mainly causes what? Paralysis. Very good. The answer is clear. Paralysis is the result that you are all trying to tell. That will also come up after some time, the paralysis part. But what is that process that happens in Causticum and why is paralysis happening is what we need to understand. Okay. So this I have taken from Richard Hughes, and of course we also have Physiological Materia Medica by Dr. Burt. So the information is from those books. So acting on the cerebrospinal system and through the spinal cord and through the motor nerves. Causticum mainly affects the cerebrospinal nervous system and it acts on the spinal cord and on the motor nerves. And the end result is what you see is it will cause paralysis. This is the small process that happens in Causticum. So paralysis is what we'll try to explore in detail. So what could be the common headings under which we can explore paralysis? This is a small question that I am trying to ask. What could be the probable headings under which we can explore paralysis? Okay, very good. Dr. Famida has an answer. Onset. And how is the progress happening? Good. Anything else? Which are all the group of muscles involved? Dr. Vaishnav has a point there. Good. Okay, is it, we are talking about paralysis, fine. Is it single muscle or is it the entire body? Fine. You are talking of the location. Which is the part that gets affected in Causticum? Good. See, these are all the common headings under which one should learn paralysis. Any other? Okay, is it spastic or is it flaccid? Fine. Then anything else? See, if you have to understand all these things very well, in the background, what is it that you will be requiring? You should have a strong knowledge of medicine. Unless you have a knowledge of medicine, fine, then the understanding of this might become a little difficult. Don't worry. At least afternoon class, students who are sleeping, this bang noise will wake them up. Okay. So, as you people rightly said, we will try to understand how a condition, paralysis, can be understood at the PG level. What else are your expectation? Yeah, we look at cause. Must be you missed that. We look at cause. We look at different types. The organs affected, is it single or is it the generalized paralysis that we have? What else? Side affinity, very good. See, majority of these things you can start contributing. Okay. Now we'll take up the first heading, and again this class I have gone through a lot of books, lot of source books. I have looked into the repertory, and the result of which is today's class. Okay, nothing mine, all taken from the source books. So we'll get back to the first part we are trying to understand. What causes paralysis in Causticum? That is the first question. You have already looked at the ailments from, fine. So please keep those ailments in your background and see and try to fit if those ailments, can they fit into Causticum. For example, if Dr. Famida is mentioning ailments from grief, now what is the type of paralysis that you are thinking of? Fine. So I will come to all those points. So can grief in Causticum cause paralysis? This is the first question. If you recall last class, I had also given you what? The effect of the ailments. So in the effect of ailments, under the ailment grief, did we discuss paralysis? Yes or no? Was paralysis discussed? Did grief in Causticum cause paralysis? Okay. We'll keep it for the discussion. Aniket, you had a point. Ailments from the cause. See, I am talking to you about particular cause. And what causation I spoke in the last class was more generalized. Now we are focusing only on paralysis. So what can cause paralysis in Causticum? Okay, so exposure to cold, fine, good. Suppress eruptions, good, that can be a point. Anything else that you can think of? Huh? History of diphtheria, okay. See, now first point, like many of you have rightly told, suppressed eruptions, okay. Suppressed eruptions, now what is it that is missing here? Shockingly missing here, the remedies that I have given, I have spoken of lacasis, soranum, sulfur, talc, lacasis is repeated, okay. Now what is it that is surprisingly missing in the bracket, the other remedies? So many times in my previous classes also I have told you, majority of the metals, they come up when we talk of suppressed eruptions. But what metals will cause? Metals, yes, good. Metals will not cause paralysis. That is the clarity I want to give you here. Aita, zincum is cuprum is fine. So those metals also has ailments from suppressed skin eruptions. And it will definitely affect the nervous system. But what is it that it is resulting in? The metals, they result in convulsions. Okay? And the metals, the result of suppression will not be paralysis. Now that is a small clarity you need to have today. Okay? So suppressed eruption was one very important cause. And second cause, see, you told me about exposure to cold air. And here again you should have a small clarity that exposure to cold air, what type of cold air? Dry. So this dry cold air has lot of value in Causticum. Okay? For example, morning you are cycling or morning you are driving on your bike, fine, or morning you are getting exposed to cold air and then you land up with paralysis. The remedy will be Causticum. Okay? And one more important thing you people missed is we should definitely compare remedies. As a PG scholar, we will have to compare remedies. So we are looking at causation, we are looking at exposure to draft of wind or cold wind, dry wind. And this is a important thing, I got it in your repertory when I was searching for Causticum. Ailments, river bathing in summer or river bath in summer. Okay? Now see the other two remedies given there, Rustox and belly spur. Belly spur. Now whenever we talk of river bathing in summer, which is the remedy that comes to our mind? Very good. Antimonium crudum. Okay? Now you understand? Probably in UG we did not understand. What we did understand, but what is antim crude leading to? They get more of headaches, they can get more of gastritis, or they can also get more of hoarseness of voice. Okay? Hoarseness of voice. See the beauty of homeopathy. See the concept of individualization. So, what Rustox person, river bathing in summer, he will have paralysis. Antim crude constitution, river bathing in summer, he might have headache, he might have gastritis, or he might have hoarseness, which is also true with bryonia. Okay? Fine? So you need to understand this. And this is what I say, you should have more of clarity. And PG, I assume, gives you more of clarity. Okay? So another beautiful symptom or another beautiful causative factor which can lead to paralysis in Causticum is change of weather. See now, change of weather, it's a comma there, warm to cold wet weather. Now again, I am bringing you to an important point here. Change of weather as a UG student, we have a lot of remedies. But as a PG student, you should have that clarity. Change of weather means from which weather? Is it from summer to winter, summer to rain? Fine. All that clarity you need to have. In Causticum, change of weather, warm to wet weather. And you already know two remedies which I have mentioned there, Rustox and Dulcamara. Rustox and Dulcamara. Now the last thing you have here, ailments from excitement. Only remedy mentioned in your repertory. Paralysis from excitement, Causticum. Paralysis from getting wet. Okay? The only other remedy you have is Rustox. And in the end, we will try to compare how Rustox is different from Causticum. Okay? So to just bring you back to track, what I am trying to do in this class is, we are trying to understand the action of Causticum on the nervous system, and we are trying to discuss paralysis in detail. Okay. So we will go ahead. Now we spoke of cause. Second thing we are speaking here is onset. Okay. Now what do you understand by onset here? Is it sudden or is it insidious? Okay. And what are we trying to talk here? We are talking about paralysis. What is the onset of paralysis in Causticum? Okay, so is it sudden or is it gradual? Gradual. Why gradual? Good. Gradual. Nobody for sudden? All for gradual? Good. So why gradual? Good. Ilam says gradual. Fine. Okay, anyway, if you see this is one remedy, especially the paralysis is gradual. Okay. This is very important. If it was sudden, which is the remedy? It could be very good. It could be more of aconate. Dr. Sunil, aconate. Or it could be more of belladonna also. Fine. So here it is more of gradual. Now there is some space that is left here. Now which are all the other remedies which has gradual onset of paralysis? Okay, Gelsemium, conium. So Gelsemium has, now that's the clarity I want to give you here. Gelsemium has insidious onset. I am talking to you about paralysis. So you have three remedies: conium, syphilinum, aluminium silicatum. It's not alumina and it's not silicea. It is aluminum silicata. One remedy. Okay. So conium, syphilinum and aluminium silicata. Three remedies with causticum. They have gradual onset. Okay. So we'll see what the next heading will be. Paralysis in causticum. What is it associated with? Any wild guess? What is paralysis associated with? Okay, very good. Could be twitching of muscles, yes. Especially in causticum, hemiplegia is associated with twitching. Okay, but here we are talking of in general. See, there are two things that you need to remember. Coldness, the affected part, the paralyzed part in causticum is cold, and the paralyzed part in causticum is numb. Numbness and coldness of the paralyzed part. Okay. So I have also given you some remedies which I have taken from the repertory. Okay. So cause, onset associated with, and Pamela was talking of the part affected. So can you tell me which is the part that is affected in causticum? Okay, fine. Dr. Sunil has something. See, now if you want to talk of this, there is something called as one-sided. I have just classified it into two broad headings so that we can have a better discussion. Okay. One is, it is one-sided. Now when I say one-sided, the question is which side? And you all know from your UG knowledge, causticum is predominantly a right-sided remedy. So one of the top remedies for right hemiplegia. Fine? Okay. So when we talk of side, it is right-sided. When we talk of the other part, now you are telling eyes, you are telling nose, ears, etc., facial, etc. Now this is what I was trying to tell you about single part. Okay, fine. Oh, this animation is not happened. Okay, so this is what I was talking to you about, single part. Now, some technical issue, but the single part I was trying to explain from head to toe very systematically, and I thought we will have three headings. What are those three headings? Which is the part affected, what is the process that is happening, and what is the end result. Are you clear with the headings? If you are clear with the headings, then it will become more interactive. So first point is what? The part affected. And we are going in anatomical order so that we don't miss. Fine? So what is that first part you would like to talk of? Eyes, good. Again, your knowledge of anatomy, your knowledge of physiology, knowledge of pathology, ophthalmology, all those things will help you understand this part only related to eye. Fine? Now this is the difficulty we homeopaths face, because for our allopathic friend, eye and part of eye, they are specialists. Fine? But here we homeopaths have to look at eyes, ears, head to toe, everything. From hair till toe, we are specialists in everything. That is our belief. We believe in the totality. It is important. Now we'll get back. When we talk of eyes, you have told me the organ, part affected. Now what is the process? What is the pathophysiology that is happening in eye, and what is the end result? Huh? Ptosis is what? Result. So there is something in between. Paralysis of, lid, because you are talking of ptosis, good. So there is paralysis of lid, which is causing drooping. I have an image, I'll just show you. But unfortunately, the animation has not happened. So everything is shown. And I don't want your, thinking to be blocked. And I know you are smart and you can give me answers, better answers than what I have prepared. Okay? So what I was trying to tell you is, acting on lids, Fine, there can be paralysis of the lids and there can be ptosis or drooping. Good, one part. You are telling something. Okay, then. No, we'll finish with eyes. Yes. Huh? Very good. Again, Dr. Aniket is talking of result. Yeah, weakness of muscles. Which muscles? Okay, rectal muscles. Good. So now this is what you see here. See, there is something called as ophthalmoplegia. Now this is a medical term for the paralysis. Okay. See, now what you see here, what you have already answered is the lids, the normal eye, the process is lids going into paralysis, and this is the result. Fine, drooping. And second thing, many of you have contributed, the muscles, the extrinsic muscle, external recti muscle, or the optic nerve itself going into paralysis. Now the result will be, what is this? Diplopia. Okay. So why a causticum person has double vision? Now this is the reason why he has double vision. Okay. Done. So as a PG scholar, if you start exploring materia medica like this, it will give you more and more clarity. Fine. And now the beauty of this is, majority of the doctors who have written, they were all allopers. Especially if you read E. F. Harrington, my all-time favorite, when we talk of explanation, he is the one who beautifully correlates the physiology, the medicine, the toxicology, everything he beautifully correlates. Because their knowledge about allopathy, the allied sciences was great. Fine. And many times we fail because our knowledge is not up to the mark. Okay. So diplopia, at least henceforth you know why there is diplopia in causticum. Okay. See, in the next step, what you can do is, if time permits, you can look at all those remedies given in your repertory for diplopia, and you can also read diplopia, what the causes are, try to understand the remedies, and you can start fixing. It will be a therapeutics. It's a very extensive job, but trust me, it is worth it. Okay. Now we'll get back to the next part. What is the next part? If you are talking of ears, what happens here? Which is in our auditory nerve? Okay, vestibular, cochlear nerve. So what you see here is, the result is what you are trying to tell me. There is deafness. So paralysis of those nerves, and the nerves will stop producing or vibrations or sound waves and all those things. There, that mechanism, there will be a problem, and it will give rise to deafness. Okay, deafness. Fine. Now deafness, at this stage I would like to share a small case. Bharat is missing. Vaishnavi was there. She recorded a very elderly lady, who had hardness of hearing. And even initially when I took up this case, I thought, okay, we'll just try. And she should be 70 plus, and she had bad hearing loss. And after a homeopathic remedy, she has taken the follow-up, and what you see in the follow-up is that she is better in terms of hearing. Anyway, we will have to get an audiometry done. It will take some time, but at least she is able to hear. Now that's the beauty. There I did not give her causticum. There, based on a different totality, the remedy given was sepia. Fine? Okay. So, see, these cases, such cases give us some boost. What our homeopathic medicines can do. Okay. So, in causticum, the problem with hearing, deafness is because of paralysis of the nerve, auditory nerve. Okay. Now again, this is a very nice area. Many of you started with this when I spoke of paralysis. Facial palsy. What is this? Facial palsy. Yeah, can I have some quick inputs from your side? When do we indicate causticum in facial palsy? Huh? Correct, very good. Yeah, absolutely right. It's a nice point to start with. It's a right-sided remedy. So right-sided, facial palsy, good. Or facial paralysis, good, very good. Yes. Beautiful. Dr. Sunil has got a valid point. When exposed to cold, see, you will have to imagine yourself in a clinical setting and think, how will a causticum patient come to my clinic? Fine. When you have that kind of a clinical orientation, I know it's imagination, but this is how you have to study materia medica. So a man, a lady, whoever it is, they have got themselves exposed to cold, dry air. Fine. Or, for example, I already gave you cycling, riding, or your car window is down, that dry breeze comes, and then you go into paralysis. Okay? Causticum. And again, I was referring the repertory. There one more point I could pick up, and they say in paralysis, they are not able to open their mouth. Facial paralysis, inability to open mouth, or opening mouth is painful. Okay? The only remedy mentioned there is causticum. So right-sided, you have already given me. From exposure to cold, that is also there. From suppressed eruptions. Okay? The only other remedy in our materia medica which is capable of producing a facial paralysis after suppressed eruption is basilinum. You can also have it in the brackets. Okay? Basilinum. And opening mouth aggravates. Yeah, riding in wind, we discussed this. And see, again, facial paralysis after getting wet. Only remedy. See, getting wet, you have got a lot of remedies. Fine. Starting from dull camera, restox, mini spiders, netrums, etc., etc. But what is important for you, if a person comes to your clinic with facial paralysis and the cause is giving is he got wet. From office, he was traveling back home and it suddenly poured. Cities in Bangalore, like Bangalore, you never know when it rains. It rained, he got wet, and then he lands up with right-sided facial paralysis. The remedy, only remedy is causticum. Okay? So, now again going down, what can you expect? See now, simple, we'll have a small recap. We spoke of eyes, we spoke of ears. Nose, there's nothing much. So we have taken up face. Now, what next? Dr. Sunil was telling something. Huh? Tongue, good. Now what do you expect in causticum under tongue? Which is the nerve? Glossopharyngeal nerve. Fine. We suppress the tongue. That goes into paralysis, and there is paralysis of the tongue. So what happens when there is paralysis of the tongue? Tongue, you are talking of the target organ. Process is the glossopharyngeal nerve going into paralysis, and we are looking at the result. Now what is the result? Now what is aphasia? What is aphasia? See, aphasia, if you read the definition, speech difficulty because of brain problems. I hope you are clear. So when there is brain involvement, okay, and then the person is not able to speak properly, that is aphasia. Okay, fine. See, there is a rubric given in your repertory, aphasia with paralysis of tongue. Only 3 remedies. What is the rubric I am trying to tell? Aphasia with paralysis of tongue. So there is aphasia also and there is paralysis also. One is causticum and the next one is stramonium and syphilinum. Stramonium and syphilinum. Okay. Now once we are done with tongue, which mainly helps in speech. Okay. Though tongue also has a lot of other functions. Lower down, what do we think? Esophagus. Good. Again, just think, what can happen in causticum? Esophagus is the target organ. What is the process? Dysphagia is the result. Yeah, correct. Difficulty in swallowing. But why is difficulty in swallowing happening? So the pharyngeal muscles, okay, the esophageal muscles, they go into weakness. They go into either paralysis, okay. So they will have difficulty in swallowing. Good. Can you add one more point in causticum? Huh? Okay, good. So they will have difficulty in swallowing. Small quantities will go with lot of difficulty. Good. One more point. If you are, Shweta has given you a beautiful clue. If somebody can pick up the clue, I don't know how many of your hearing is acute. Don't look at Shweta now. Tell me, Shweta, what did you tell? Don't look at Shweta. But Shweta has already given you a point. But you'll have to modify that point. Or at least after class, tell Shweta why you did not tell the right point. She is telling regurgitation. There's something that will happen in causticum. Okay, chalo, more than hawking. It will come from ears. It will come from nose. Many times you see liquids, food coming out through nose. Okay, that is because of this mechanism where you are not able to swallow. They are all in weakness. Fine. And when you attempt to swallow, food or the liquids, they come out through nose. Where do you look for this rubric in your repertoire? Throat, good. Yeah, throat, it's a big thing. What under throat? Good. At least I'm happy you didn't tell nose. Throat, good. See, throat, there is a rubric, liquids escapes out of nose while swallowing, something like that. So that is the rubric you can think of. Okay? Throat swallowing, liquids come out through nose is how the rubric goes. Okay? So in throat, the pharynx, the esophagus, they go into problems. Okay? So low down, what else? Which is the other area you want to talk of? Intestines, good. What happens to the intestines? Intestinal movements, yeah, we'll come to it. Yes, I am going from the system. Yeah, we'll come to it. Respiratory, we'll come to it. We'll finish with J. Okay. So, what is it, intestines? Okay, so more than that, we'll focus on the rectum. So, what happens in causticum? The rectal muscles, they go into paralysis. So, what happens? Okay, do you have involuntary stools in causticum? Okay, good, very good. Constipation, no problem. Constipation. Now, what is the speciality of? Can pass stools only while standing. They can pass stools only while standing, which is the only other remedy. Okay, Vaishnavi has got a remedy. She says muriatic acid. What happens? Okay. See, in muriatic acid, every time they urinate, there will be prolapse. Which is other remedy in brackets? Barataka. Now the other remedy I want in brackets, they can pass stools only while standing. What is income? Don't give me different remedies and I can't demonstrate, How is it in Zincum? Zincum, they have to sit and they have to bend back. That's what I'm trying to tell. Don't, good. Anyways, I'm happy you spoke of Zincum. Good. Any other remedy you can think of? Better, can pass stools more comfortably while standing. See, but if you imagine, it's a very, very serious process. How can somebody stand? I don't know how many of you have imagined, but I have imagined this. It's a difficult process, but when they do pass in causticum, it's a messy thing. I don't know if you're getting the process that I'm trying to tell you. Okay, now before, see, Medornum has again a different, different thing. Forward is income, backward is Medornum, if I'm right. Yeah, urine is zincum. Urine stool, fine. Now, the only other remedy is, no, it's not natrum. What happens in natrum? Natrum, crumbling, okay. See now, the other remedy is alumina, the only other remedy. And alumina and causticum, especially in paralysis, they come very close. If time permits, we will try to discuss under comparison. So, comfortable passing stools, standing position, causticum and alumina, okay. Now, must be this, yeah, Dr. Sunil was particular about the larynx. Now, if you look at the larynx, what do you expect in causticum? Now, the vocal cord here, I have got you a picture from Google Images, which is showing you an image of paralyzed vocal cord. The vocal cords here, the white one here, they are paralyzed. Now, what happens when the vocal cord goes into paralysis? There can be loss of voice, or if it is in the process of going into paralysis, only paralysis, then you can expect hoarseness. Their voice will not be very loud. They are not able to speak loud. Hoarseness of voice. Okay? And in hoarseness, causticum has something very special. Okay? We will discuss under particulars. So hoarseness of voice, or there can be aphonia, loss of voice. Now this is what we have already discussed. And what did we discuss here? This part is the constipation. Constipation, passing stool, easier when standing. Not that sitting he can't pass, but standing is more comfortable for him. Okay? Fine. Now any other areas that we have missed? Keeping the anatomical thing in mind. Urinary bladder. Urinary bladder. Again, what can happen? Keep the anatomy and the physiological point in mind and you start contributing. Huh? Yeah, very good. There can be both. Good. See now, this is the advantage of you having a better medicine knowledge or allied subject knowledge. So on the bladder, what causticum does is it can do two things. Fine. I have got your common image. It can be either retention or it can be incontinence. For both, we have causticum getting indicated very often. Now what happens here is, why retention? Or because of retention, what will happen? Urine gets retained, fine. The bladder muscles, they are not in a state of pushing it, fine. So the urine will be retained in the bladder. So as Elam rightly said, there can be dribbling. There can be dribbling. Okay. Now you have something very special, and causticum is the only remedy in your materia medica which has a speciality. So I thought you should know because we are discussing causticum. Flow involuntary while sitting. Okay. If he sits, there is no control. Urine is passed involuntarily. See, these are all very embarrassing and very messy problems. Okay? We have to, if you get a chance, you have to treat. Especially people with neurological problems. What is it? Myasthenia. Okay, myasthenia gravis. And which is the other condition? Parkinsons. I'm sorry, I was talking to you about Parkinsons. Parkinsons. Fine. Where the nerves, the muscles get involved. These are all common problems. Okay. Very embarrassing. We see adults using diapers. Fine. Has to wait long, only a little urine passes. See this. They have to wait long, meaning they have an urge. They go, they have to wait long. And you will have to understand the, very serious mechanism of nerves and the bladder. Okay, fine. It's a very complicated neurological mechanism. Fine. So they get an urge, they go, but they have to wait for a long period, and only then a little urine passes. Here they have no issues with prostate. You will have to be very clear. Here the issue is more with the nerves. Nerves. Okay. So this clarity you need to have. Okay. We'll go ahead, and there's another very important thing under bladder, and that is incontinence. Incontinence. Now, incontinence you all know. What happens? Yeah, I mean, again, see the beauty of repertory. If you look at repertory, there are so many things where causticum is strongly highlighted. We all know when they sneeze, when they cough. Can you think of any other condition where there can be incontinence of urination? Laughing, causticum is a 3-mark remedy. Sneezing, laughing, walking, okay? And the worst is blowing nose, causticum. Even when they blow nose, the urine escapes. Incontinence in old women, only remedy is causticum, okay? So let me just see if I missed something. See, on blowing nose, coughing, on excitement, on exertion, laughing in old women, and on sneezing. These are all the causes, or these are all the triggers which can increase incontinence. Okay. Now, after incontinence, which is other area? Extremities. The last part, we are going down, about down. The last part here is extremities. Okay. Now, extremities, what do you expect? Very good. Dr. Sunil has a point. Hemiplegia. And you know the side. It's mainly right-sided hemiplegia. Now, can I have some causative factors? What causes hemiplegia in causticum? What are all the causative factors? Okay, I mean from the causation, meaning what ailments we have spoken. If you can, okay, suppress eruption, exposure to cold, okay. So I mean there are few things that you need to remember. Now, paralysis which is of gradual onset. I told you only remedy. Paralysis of extremities. See now, did I give you a few more remedies? 3. Syphilinum, conium and aluminum silicator. But I have put only here. Why? Only extremities. If the paralysis is gradual, causticum is only remedy. Paralysis gradual, anywhere else, you have 4 remedies. You are clear? Fine. So, gradual and then after exertion, after getting wet, and after suppressed eruptions, you have told me, river bathing. Okay? If there is hemiplegia after river bathing in summer. See, this is a common activity kids do. Fine, summer they just go fall in river, or they play in river, water. So this is what you have in causticum. Coldness of parts with, okay, coldness of parts with. So these are few things you need to remember when you talk of hemiplegia. Hemiplegia, okay. So are you clear with what I was trying to tell? Is this type of learning worth? Meaning, see, it will have a practical touch, and what we did for last 45 minutes is, we have spoken only about paralysis. And a step ahead, if your medicine knowledge is great, we can go more detail. Fine, what type, etc., type of paralysis, etc., we can discuss in more depth. Okay? Before I close today's class, we will look at one very important component. Okay? And this component is comparison. This is a very vital component in homeopathic learning. Okay? So, before I start comparing remedies, I would ask from your side, as a PG scholar, I have given you the indications, the characters of causticum in paralysis. Keeping that in your mind, which other remedies come to your mind? Which remedies you feel deserves a comparison with causticum? Very good. Alumina, Vestox, Gelsemium, Curer, I have never used courier for paralysis, but I have used courier in many OCD cases with very good improvement. Okay? Fine. Only 4 remedies? Plumbum, zincum. Why not aconite? Aconite to zincum. So any remedies can come up. See now the remedies are quick here. Few remedies will try to take it up. And conium itself is a remedy that needs a mention here. Conium, aconite, cocculus, plumbum, gels, dull, zinc, and the list can go on. Okay? I am just giving you a jalak how the comparison has to be made, and you can take it further. Okay? So first we'll start with aconite. Yeah, before I start giving from my side, when do we think of aconite in paralysis? When it is of sudden onset, exposure to cold, dry air like causticum. But the only difference is aconite is sudden and causticum is chronic. Again, if you read E. F. Harrington, which I personally feel, I strongly recommend a PG scholar to read Clinical Materia Medica by E. F. Harrington. More than comparative, I love Clinical Materia Medica. Beautiful book. And Clinical Materia Medica itself is done a great job of comparing a lot of remedies. Okay? So, aconite, according to Dr. E. F. Harrington, when it is sudden, and he says, after some time, aconite will not work, and that's where he says causticum will come in. Okay? So, to complete the paralysis, to complete the cure, he says, think of causticum. But motor paralysis, see, there is something called as sensory paralysis, and there is something called as motor paralysis. So here you have more of motor paralysis. Dr. Sunil rightly told, exposure to dry cold winds, sudden, and see that it is in the initial stages. Very important. And that's where many times we miss aconite. By the time they come to us, that initial phase will be over, and we would have missed aconite. Okay? Now the second point is cochlear. Cochlear. Any quick inputs? Okay, after nursing, after watching. Okay, they are all ailments of cochlear. But paralysis. Okay, more than gradual. See, again, I don't know, some books I had referred. I personally not used all these remedies in paralysis, so I can't share cases here. But nevertheless, you should have the information. See, now in cochlear, he says it is more of functional paralysis. What is this functional paralysis? Huh? Functional paralysis. Okay, there is no structure involved, there is no structural damage happening. As I understand, it will be more at the level of emotion. Some emotional cause bringing in a paralysis. CT might be normal, okay, and the other investigations might be normal. So it's mainly at the physiological level. Okay, so a paralysis that comes after fatigue or mental exertion. Now fatigue could be night watching, and mental exertion could be nursing, and mentally involving so much. What will happen to my relative, my father, my wife, my son? They are sick, and that worry can cause paralysis in cochlear. Okay? Paralysis of face, tongue, pharynx, and extremities. Now, plumbum, beautiful remedy. Plumbum. Now, what information you have about plumbum when it comes to paralysis? Huh? What is it? Okay. Somebody used this word. Which group of muscles gets involved? So when you have the extensors, when you have the extensor muscles getting involved. Now what happens when the extensor muscles go into paralysis? You will mainly have wrist drop, you will mainly have foot drop, all those things. So this clarity is what you need to have. So when I said drop, we had a phone drop. It's different from wrist drop. Okay, chalo. Anyway, no problem. See now what you need to understand about plumbum here is, we were talking of extensor muscles getting involved. I should have asked you the other remedies, but I know your vision is sharp. The other remedies are already there. Swati was talking of courier. Curer where the extensor muscles are paralyzed. You also have arsenic. You also have alumina. You also have Crotalus horridus. Okay, one more remedy from C, cocculus. If it is flexors, paralysis of flexors, I'll give you a small clue. We have only 2 remedies. See, cuprum is more of spasms, is more of convulsions. I am talking to you about the flexors getting involved. Only 2 remedies. If alumina is extensors, causticum is flexors. When the flexor group of muscles are paralyzed, the remedy is causticum and natrum. Causticum and natrum when the flexors are involved. When the extensors are involved, you have those 6 remedies. Paralysis from diseases of spine. Can you give me 2 or 3 more symptoms from your UG? From your UG knowledge. What happens to the paralyzed part? The paralyzed part is atrophied. Now, how is this different from cocculus? How is this different from cocculus? In cocculus it was functional, good. In plumbum it is more structural. Fine. So, in plumbum there is more pathology. There is a serious pathology. Serious pathology of spine, serious pathology of brain, and that's the reason the atrophied part is going, the paralyzed part is going into atrophy, wasting. Fine? Okay? So now this is what you need to understand. Atrophy of the affected part and paralysis with contracture. So all this I have taken from Dr. E. Farrington's Materia Medica. Paralysis with contracture. What is contracture? Tightening. Rigidity, tightening. So paralysis with contracture. Plumbum. Okay? Any clarification here? 3 small remedies: aconate, cocculus, plumbum. All clear? Okay. Now we'll talk of gels. One of our favorite remedies for paralysis. Now how is it in gels? Okay. Okay, fine. Now Aniket is talking of anxiety. So what you also understand here is Gelsemium will have more of functional paralysis. Fine? Gelsemium will have more of functional paralysis. In Gelsemium, the paralysis can be motor and sensory. In Causticum, it was more motor. Here it can be both motor and sensory. So muscles are very weak. If you remember our old Materia Medicas, muscles will not obey the will. There is so much of slowness, there is so much of weakness. Gelsemium. Okay? Now zincum, very important remedy. Zincum. In zincum, like plumbum was more of spinal pathology. Zincum when you have more of brain pathology, cerebral pathology. Softening of brain, giving rise to paralysis. Zincum. Okay? And the affected part will be numb, and there is a lot of formication, as if some insect, some ant is moving. Paralysis after suppressed foot sweat. Paralysis after suppressed foot sweat. Paralysis associated with vertigo, trembling, numbness and formication is zincum. One more remedy here is Dulk. We will discuss Dulcamera. We will also compare Restox. We can also compare Conium. Though I have not written, I can just share few valid points. Now what happens in Dulk? Yeah, Dulcamera is paralysis from exposure to damp, wet weather. See, dry, cold weather, initial stage, which was the remedy? Chronic was? Wet weather, they get exposed, and if they have paralysis, initial stage is Dulcamera. Chronic is beautiful, Restox. Chronic is Restox. So clear aita? Dry weather in the acute, sudden is aconite, followed by causticum. Adhe tara, if it is because of wet weather, acute will be dulcamera, chronic will be Restax. Fine? Okay? All credits to Dr. E. Farrington. I feel very sad because he should have lived long. Unfortunately, he died very young. He would have contributed a lot and we could have enjoyed. We could have learned a lot from him. Okay? Now, now I am talking to you about Restax also here. Restax also like dulcamera. Wet weather, but it is chronic. It is chronic, Restax. You would have studied in Materia Medica. People sleeping on wet parks, wet pavements, they go into paralysis. The remedy, again, Kent lovers, it is beautifully described in Kent. The remedy is Restax. Alumina. Alumina. What was the point we discussed? Paralysis of extensors. Extensors or flexors? Extensors. Flexor only two. Causticum natrum. Only two. Don't get yourself confused with those remedies. Alumina. Again you will have a lot of slowness. Fine. Okay. Done. And again from head to toe like causticum, alumina also has paralysis, paresis in many areas. Okay. Probably more of dryness. Fine. Okay. And the last remedy for you here will be conium. Okay, more than ascending. Good, agreed. It's a very important remedy for GB syndrome. Yeah, correct, good. Guillain-Barré syndrome. Ascending type of paralysis. Okay. Now one more very important point in conium. As you all know, mentals, if you look at the mentals, they are more materialistic. They are more money-minded. Fine. They dress at their best, meaning these are all the other things. When you compare it with causticum, causticum is not that money-minded, fine. Causticum is not so egoistic. Causticum is not so haughty like conium. Causticum is more benevolent. Causticum is more sympathetic, fine. So these are how you compare and you understand. See, now what we have done is we have just taken one condition. Similarly, if you take warts, if you take this, that and all, whole of our PG will be doing only causticum. That is the tragedy. But I am trying to introduce as many concepts as possible so that you can pick it up. And you can start learning. See, suddenly I get some thought, some idea, I just write it down and I work on it. And that is how it ends here. Fine. So, before we close, we'll just try to have a quick recap. What did we try to understand here? We tried to understand the paralysis, in particular about causticum. We looked at the causes, there were plenty. And then we also looked at the character of paralysis in causticum. And in the character or under character, we looked at the onset. And in causticum, you all know, the onset is gradual. And we also looked at the side affinity, which side, the right side or which part from head to toe we try to understand. And we also looked at the effect, meaning affecting the eye muscle or affecting the ear nerve, auditory nerve. What is it doing is what we try to understand. And in the end, we tried it to compare with similar remedies. Okay. So this was a small model of how a condition can be understood. We can improvise on this, as I told you, bringing in more of medicine knowledge, we can go to a different level, which when time permits, we will definitely take it up. So, for today, causticum, paralysis. Any questions before we close? All clear? No problem. See, if you have no questions now, we have crossed our time. We will definitely take up the questions in the next class so that we can close the class on time. Okay? Anyway, thank you. Thanks. Yes. Yes. Correct, correct. Yes. Paralysis. Yes. Yeah, definitely. See, Dr. Sunil is talking of a situation where the weather is not cold or the weather is not damp, it's not raining and all. For ventilation, for air, we sleep out and we get exposed to that dry air. And then we get up with paralysis. Fine. Ideally, the remedy will be aconite to start with. And must be as it goes on, you can definitely think of causticum a little later. So it's a live example that you can think of. Okay. Any other contributions? We'll stop. Chala, thank you. Thanks. Thank you.